segment is sponsored by Intermountain Healthcare and the Utah Department of Health.
October may be over, but breast cancer screening is saving lives every day of the year. Mary Nichols, along with West Valley City's police chief, explain why scheduling an annual mammogram needs to be a priority.
The way I look at it, a few seconds of discomfort and a little pain could save my life. I'm all right with that.
7 years ago, I got a mammogram that would eventually save my life.
1, I'm done.
I have you come stand right up here to the machine.
Now, West Valley City Police Chief Colleen Jacobs is showing just how simple yet essential it is to make time for an annual mammogram.
It's an important message, and that's why I was willing to share it with the public.
We want to get the word out that women should begin annual screening mammography at the age of 40 and continue every year for as long as they are healthy.
If you have a family history of breast cancer, like Chief Jacobs, recommended screenings might start even sooner.
My mother had breast cancer at age 40, so in talking with my healthcare providers, they recommended that I started my mammograms 5 years before she was diagnosed, so I started mine at 35.
Despite her busy schedule, getting a mammogram is a yearly priority for Chief Jacobs.
It's the same as getting my annual blood check, my twice-a-year dentist check. It's just part of healthcare and wellness.
As we see today, the police chief of West Valley City had time to come in, and if she can take time out of her busy schedule, then I think anybody can. But it's very important that people make time for this, because 1 in 8 women will ultimately develop breast cancer.
Getting a mammogram is a quick process, and while it might be slightly uncomfortable, it also saves lives.
Best way for treatment for this particular disease is early detection, and the best way to detect it is to get the screenings done.
Mary Nichols for